So the services that we have are hospice, home health, which those two, I had no idea what the difference was when we first started. I'm like, aren't they the same thing? Don't they do the same thing? They actually do not do the same thing. And so I'm going to talk about the differences between those. You also have a PA or a physician's assistant or a doctor. Can have a dentist come in, a podiatrist, a hairdresser, a chaplain, and then mobile x-ray and vaccine tech. So we'll be talking about these specific ones today, breaking them down again, very kind of broadly in a broad way so you understand exactly what the services provide and how they could really benefit your home. So the first one is hospice. And I remember when we first opened, I thought hospice meant death, right? I think that's kind of a connotation that a lot of people think that, oh, your mom went on hospice, that means she's going to die in 2 weeks. That's not necessarily true. Hospice, it is an end of life care, but I have actually had an individual in our home go on hospice because he was declining rapidly when he first moved in. But then he actually started getting better. And so then he actually got off of hospice. So there are certain situations where that will happen to you. Well, the service that you're providing at your home will be so amazing. It'll almost rehabilitate that individual, and hospice cannot cover that care anymore. So hospice is paid by the state. They are a team pretty much that focuses on patients nearing the end of life and also helps the families as well. So what I love about hospice is not only are they providing amazing care for your grandma and grandpa in your home, but they're also providing care and support for the families, which I think is vital because the families are struggling, right? Dealing with my family member is nearing death. I don't know how to process that. And so hospice comes in and they do a lot of education with the families on, death and grieving and the process of it all. So it's almost like you don't have to take on that role as like walking the families through it. Hospice can come in and take that role and pretty much walk them through it so gracefully. They actually follow up with the families even a year after death. So it's just fantastic. Love our hospice companies. I put all of the hospice companies that we work with currently. Highly recommend that you don't just use one hospice. I think that's something that we learned in the beginning. You're going to have a lot of hospice companies come to you and be like, I'm the best hospice company. I have the best nurses. If you call us, we're going to be there in 20 minutes. Like they have all these like sales pitches that they try to sell to you, right? And they'll bring you candy and all these stuff to win you over. But what I really care about is not me and giving me gifts. I want you to make sure that you are taking care of my grandmas and grandpas. That is the number one thing. They need to be taken care of. And so we had one hospice company, and the individual that we were working with was amazing, but then they moved to a different hospice company, and then the hospice kind of wasn't as great as it was before. And so we actually had another hospice company in our house. We had two at the time. And so we kind of just transferred over to the other hospice company, which is kind of not the easiest thing to do as far as paperwork and back end stuff. But if they're not doing their work, it's nice to have another hospice company in your home so you can transfer it over. So highly recommend don't put all your eggs in one basket with the hospice company. It's nice to have at least two so that you can just make sure that they're getting the best care possible. I wouldn't recommend like doing like a different hospice company for every individual in your home. It just gets a lot with knowing who to contact and, when the shower aide comes in to shower them, knowing, who's going where, and, it just can get kind of overwhelming. When we have our shower aide come through our hospice company, she comes 3 times a week and she's on a schedule on the showers. We just know, okay, this individual, her name is Nancy. She's coming in and she's showering this person, this person, this person, this person, because we know majority of individuals are on that hospice company. So there's no set rule on what hospice company you have to use or how many you use. It's your discretion. So if you have a certain hospice company that you like and that their service is amazing, we usually recommend it to our families when it's that time when they need to start going on hospice. We don't pressure or push families to make certain decisions based on, our experience. We just tell them, hey, we worked with this company for the last 3 years. They're amazing. We love working with their nurses. Their shower aids are amazing. And so then the family makes that decision. But you, as the owner of assisted living, cannot make that decision for them. You just provide 2 or 3 recommendations, and then they decide from there. So hospice works with the physicians, so the doctors or the PAs in your home. They work with them, and they also work with the family to make pretty much your grandma and grandpa as comfortable as possible, in the setting of your home. And so with that being said, another thing I wanted to highlight, if a grandparent is on hospice, you cannot call 911 because hospice is end of life care. It's palliative care. It means like it's just making them comfortable within those last, few weeks or few months of life. 911 cannot be called. So if you do call 911, if something happens, say their blood pressure drops or they're not moving or something happens, right? You call your hospice company. You don't call 911 because if 911 does come out, they can't do anything because they're under hospice care. So that's something that I learned the hard way when we first opened. There was an individual who was on hospice. I had no idea that you can't call 911. I think it's our just reaction, right? As humans, if someone's hurt, you call 911. And so that's what I did. And then they showed up. They're like, oh, well, is this person on hospice? And I'm like, yeah. They're like, well, then we can't provide care because they're on hospice. I'm like, what do you mean? And so I had to learn the hard way. He thought I was crazy. Like, wow, you own this place. You don't even know what you're doing. But it was something that I learned. I had no idea. So I just wanted to highlight that. So y'all don't make that mistake as well. So hospice is designed to help patients, there's no longer a cure. Say they have cancer or maybe they're just old, right? Maybe they're in their late 90s and early 100s and they've hit that point where, they're going to be passing on soon. And so it just makes them comfortable. If no other treatment options are available, they come in and they make them comfortable within those last few moments of their life. So as far as hospice, I also wanted to say a note that if we utilize our hospice for a lot of things, they don't just come in and take care of our grandparents and shower them, which is their job, right? That's what they're supposed to do. But we also utilize them for staff trainings. So if we have a monthly meeting with our staff and we'll ask our hospice company, hey, are you able to come in and talk about transfer training or come in and talk about showering? Because that's something that is super important for your Platinum Angels to know, or your caregivers to know. And so they'll be like, yeah, of course. Since they're in our home, they want to, I don't want to say woo us, but they want to make us happy, right? And so they'll come in and they'll do staff trainings. They also do a lot of activities within our home too. So we have our hospice comes in, actually see in this picture, that's our hospice company. We use Altus Hospice. And that's the shower aid in the center. And then our chef is giving bunny ears in the back. But they're like our family, honestly. Because they come to our home so often and do activities and do staff trainings. They even give, they catered Chipotle one time for one of our staff trainings. And so they come and they give gifts all the time to our Platinum Angels. And so they're very much involved in our home. I think our hospice nurse, he comes in, I think, every day to our home. And I think he does that because he wants to give the best care, but I think he does it because he loves our environment. He'll sit on our couch for like a couple hours charting from all of the individuals that he saw earlier in that day. I think just because he's comfortable in our home. And so creating that space, not just for your family members and the grandparents in the home, but also for your outside service providers is super important. So hospice is amazing. I love hospice. They provide a fantastic service. It's paid through the state. It's not paid through you. So once you put them on hospice, you're not fronting the bill or anything like that.